Have you ever had a small, strange symptom that you brushed off? Maybe a little dizziness, a moment of forgetfulness, or a change in how food tastes. It's easy to ignore these things, especially as we get older. We tell ourselves, it's just age. But here's the truth. After 70, your body may not send loud warning bells when something's wrong. It whispers. And if we listen closely, we can catch problems early before they turn into something serious. Today, we're going to uncover 6 silent symptoms that you should never ignore after 70. These aren't meant to scare you. They're here to protect you. Let's take care of ourselves and each other by understanding the signs our bodies try to show us. Let's begin. 1. Sudden confusion or forgetfulness. Everyone forgets a name now and then, but when memory lapses come on quickly or are accompanied by confusion, it's time to pay attention. Sudden mental fog, trouble following conversations, or forgetting how to do familiar tasks can be early signs of a stroke. Mini stroke, also known as a TIA, or even an infection like a urinary tract infection, which affects seniors very differently than younger people. Take George, 74, from Birmingham. His daughter noticed he kept asking the same question over and over during dinner. He also seemed irritable, which was unlike him. She brought him to urgent care, and it turned out he was having a mild TIA. Early treatment helped prevent a major stroke just days later. Don't wait for dramatic signs. Sudden mental changes, even if they pass, are a red flag. 2. Loss of appetite or unexplained weight loss. Have you stopped feeling hungry lately? Or noticed your clothes are looser without trying? A gradual loss of appetite can be a sign of many things, from depression and loneliness to thyroid problems or even certain cancers. And it's often ignored because it doesn't cause pain. Eleanor, 78, from San Diego, slowly stopped eating meals with her family. She wasn't in pain, just not that hungry. Her daughter insisted on a checkup. Blood work revealed a vitamin B12 deficiency and the beginning signs of anemia, both treatable but potentially dangerous if missed. As we age, our sense of taste and smell can change too, which makes food less appealing. But if you're skipping meals or losing weight without trying, your body may be calling for help. 3. Changes in balance or frequent tripping. Have you been stumbling more often or feeling off balance? This isn't just getting old. It could be an early sign of Parkinson's disease, inner ear problems, or even medication side effects. Let's talk about Marjorie, 80, from Melbourne. She always prided herself on walking every morning, but recently she found herself grabbing the walls and tripping on the carpet. She thought it was just her age, but after a fall that bruised her ribs, her doctor discovered her blood pressure was dropping too low when she stood up. A simple change in her meds made a big difference. Your balance reflects your brain, your nervous system, and your muscle strength. If it suddenly feels off, don't brush it off. 4. A persistent cough or hoarseness. If you've had a cough or a raspy voice that lingers more than 3 weeks, even without fever, it deserves a closer look. Many seniors assume it's just a cold or allergies, but it could be a sign of acid reflux, heart issues, or even early-stage lung disease. Charles, 73, from Vancouver, had a dry cough that wouldn't go away. No fever, no phlegm, just annoying. When he finally mentioned it to his doctor, a chest x-ray revealed early-stage COPD. Catching it early meant he could make lifestyle changes and start treatment before it became severe. Don't ignore the quiet symptoms. Your lungs are your lifeline. Listen to them. 5. Subtle changes in vision. Not all vision problems are sudden or dramatic. In fact, slow, subtle changes can be more dangerous because they're easier to ignore. Have you noticed more trouble seeing at night, or things looking cloudy or dim? It could be cataracts, glaucoma, or macular degeneration, all of which are treatable if caught early. Helen, 77, from Manchester, found herself squinting while reading and bumping into furniture. She didn't think much of it until she misjudged a curb and fell. Her eye doctor diagnosed early macular degeneration. Special vitamins and early care helped preserve her sight. Your eyes are constantly adapting. But if you notice you're straining more than usual, don't wait. See a professional. 6. Shortness of breath with simple tasks. If walking across the room or climbing one flight of stairs suddenly leaves you winded, it's time to check your heart and lungs. This symptom is often dismissed as just being out of shape, but it can be a warning sign of heart disease, lung problems, or anemia. Let's talk about Frank, 79, from Chicago. A former construction worker, he was always active, but lately, vacuuming left him needing to sit down. His wife insisted on a doctor visit. Tests revealed he had early congestive heart failure, but because they caught it early, his doctor was able to manage it with medication and lifestyle changes. Breathlessness is not just part of aging, it's your body asking for attention. Aging gracefully isn't about ignoring changes, it's about staying aware of them. These silent symptoms don't always scream, but if we listen carefully, they can save us before a crisis ever begins. Now, I'd love to hear from you. Have you or a loved one experienced one of these subtle signs? What's something your body has taught you recently? Please share your thoughts in the comments. And if this video helped you, give it a thumbs up, subscribe to the channel, and share it with someone who might need it today. Because sometimes a quiet symptom deserves a loud conversation. Take care and stay well.